In this video, we are going to discuss about the IC monitoring. By the end of this topic, the students are able to describe the foundational goals and guidelines of a real-time patient tracking with the ICU, that is intensive care unit, and they can able to analyze the critical patient behaviors such as anxiety, restless, and confusion in response to the clinical environment. To introduce this topic, the primary overarching goal of monitoring any critically ill patient in an ICU is to detect physiological problems and manage them as early as humanly possible. So, to achieve this level of early detection, important biological and physical parameters must be monitored at the regular, strictly defined intervals, that is in a correct manner. Every single one of these parameters must be actually recorded on the patient monitoring chart, serving as clean baseline for the automatic systems and clinical staff. So this building on this systematic approach, when a new symptom, that is clinical symptom or unexpected sensor finding appears any routine monitoring, there will be there will be cause such as immediately it can begin. We must ignore a trending change in the vital sign. So here we are having the guidelines. This brings the directly to our formalized guidelines for monitoring the patient. When acquiring the data, we don't just look at the isolated electrical numbers, we constantly correlate sensor waveforms with the actual physical behaviors of the patient. So in seeing the behaviors of the patient, first the major behavioral state that we observe is the anxiety and the fear. So patients often experience high level of stress as a direct response to the hyper-connected noisy ICU environment. When fighting against a ventilator, this will be coordinate to use the appropriate sedations to calm them. And next one is the restless and agitation. So if a patient is tossing and turning, we must immediately check for hypoxia. We double check the physical SpO2 clips and examine the patient ventilator system to ensure it doesn't disconnect during movement. And even finally we monitor for extreme neurological updates, that is confusion, disorientation, decreased responsiveness, or a total lack of response to external stimuli. So to standardize this data collection, clinical teams will be using the GCS, that is Glasgow Coma scale, to determine the patient's exact level of alertness based on their eye, verbal and motor responses. So just like with the agitation, sudden confusion is often an immediate red flag for severe cerebral hypoxia, and also therefore we must immediately check for dropping of this PaO2 by analyzing the digital SpO2 output and verifying the integrity of the patient ventilator interfacing system. By tightly marrying this sensor data with these behavioral parameters, we can able to build an airtight life-saving ICU tracking network.